Tomorrow, July 9th, 2020, marks the completion of 8 incubation cycles since the first case of COVID-19 was identified in Pitt County. In those 16 weeks, we have accumulated 846 cases of COVID-19. We have lost 9 residents to COVID-19. But please consider this: the vast majority of individuals infected with COVID-19 have recovered from COVID-19. So there is some good news in those numbers. And I'm going to try to get a recovery count done for you all today and update that today. It's a laborious process. We are working to increase the availability of testing for COVID-19 here in Pitt County. I'm sure you all saw our written release yesterday. The Pitt County commissioners were gracious enough to give us money to fund testing in the county using funds that the county received from the CARES Act, some federal money to support COVID-19 testing. To that end, we will be offering testing at multiple sites, including J.H. Rose High School, and several rotating sites around the county to include the Farmville Community Center, Bethel Elementary School, G.R. Whitfield Middle School and Primary School in Grimesland, Ayden Middle School in Ayden, and the Winterville Fire Station, Rural Fire Station, I believe it is, in Winterville to hit that population center. We anticipate bringing a second fixed site online within the city of Greenville, but I have to meet with that individual this morning and do a walkthrough before we can put that out. So we anticipate that will come out in a written release as well. And then I want to remind you to wear, wait, and wash. So wait 6 feet from people and wash your hands frequently. And I'm happy to take your questions this morning.
Awesome. Yeah, if you could just, tell me, what is the most alarming thing about the current rise in cases right now in Pitt County?
Well, I think people have had enough of COVID, and maybe aren't taking the steps to protect themselves that they should be. When I've been out in the community, I do see a fair number of people wearing masks, but I also see a fair number of people who are not wearing masks. So I think we need to do a better job of wearing masks. I would mention that I'm well more than 6 feet from you all this morning, so I have my mask down so that you can hear me speak clearly. But it is important to wear a mask out in the community. I know my wife, as I mentioned before, is not happy when I tell her she needs to do that, but I do make her do that. This is when we last talked. It still remains in that 25 to 49-year-old group, sort of the younger, healthier adult group, which is good and bad. That is a group that's likely to have mild to moderate illness. There have been some hospitalizations in that, but the risk of a serious illness or a fatal outcome is very low in that age group.
And are there, in the coming weeks, any group that is at high concern, or does it stay in that older group right now?
Yeah, the primary concern for severe outcomes remains in those over age 65, especially those over age 70. And if you look at the deaths, they're very much skewed to the older age group and the over 70 or 75 age group.
And when it comes to resuming in-person classes, whether that be like K through 12 or colleges in Pitt County, what is that outlook kind of looking like right now regarding?
Well, we're still officially waiting word from the governor as to how that will happen. I have had some very preliminary discussions with Dr. Lenker, the school superintendent, about that. And, we've been asked to plan for 3 contingencies: minimal social distancing, moderate social distancing, and then a full online sort of menu. And I know his staff are all working on those educational plans, and we will assist him in any way that he needs assistance.
Certainly, and going back to the masks, what would you say to people who are refusing to wear masks
Yeah.
right now?
I would say please do it. While it offers limited protection to you, it does protect other folks from you. And we know that many people have very mild symptoms with this, may not realize that they even have it. And if we can help break that transmission, we need to do that. Remember, we're the fuel for this fire, and if we don't do something to keep that fire from getting to the fuel, the fire is going to continue to burn.
Thank you, Dr.
You're welcome.
Is community testing something that we've been working towards, making sure it's available, and what's making all of this possible?
We have been working towards that. As you know, the testing has been a problem throughout this. with lack of availability of a test to start with, and then limited availability of the test. Reagents, I guess, are still a struggle nationally. When you look at the big commercial laboratories, their turnaround time frame has gotten longer again because of the number of folks being tested and because of some limitations in reagents. So we're now with LabCorp experiencing about 5 days turnaround time. We're about 5 days with the state laboratory. I'm not sure about Quest. We haven't used Quest as a lab vendor, but I would guess that they're probably in that same sort of range. We do have an advantage here in Pitt County with Vidant Health. Has made a great investment in testing capacity, testing instrumentation, and testing reagents. And they are able to offer us a 24-hour turnaround time or less on most testing that we send to them. So we actually...
These testing sites that are going to be available, do you know about how many days it will take for them to get their results back?
We are working with Vidant to use Vidant for our testing sites or testing vendor, and they have promised us 24-hour turnaround time on that.
Wow, okay. And this is for a different story, but is it more effective, do you have any knowledge that COVID, living on clothing, would it be more effective to get your clothes dry cleaned as opposed to using laundry detergent?
Well, because of the heat. The virus is what we call an encapsulated virus, which means it has a fatty layer around the outside of it, a fatty coat or a fatty envelope around it. So anything that disrupts that fatty envelope inactivates the virus. So normal laundry detergent would do that. Dry cleaning fluids, which are generally a non-polar solvent, an organic solvent, would do that as well. So I don't know that dry cleaning is necessarily more effective at removing COVID-19 from your clothing. I think normal laundering is fine. If it's a dry clean item, I think dry cleaning would also remove it from your clothing.
Okay. And is it a good idea for doctors to take their scrubs to the dry cleaner, or do you think that it would be fine if they just wash them?
I think if their clothes are washed normally and dried normally, that would remove that from either scrubs or a lab coat.
And how long does the coronavirus live on clothing?
That's a good question. I don't have an answer for that. We know on hard surfaces, depending on temperature, relative humidity, and amount of sunlight, that the half-life can be in minutes, a few minutes. So we look at probably less than 10 minutes on a hard surface under the right conditions. But clothing, a little less clear on a softer, porous surface like clothing.
Okay. And I know that you can't speak for Biden, but as of right now, do we have enough, supplies and beds available for a surge if we are seeing something like Charlotte is right now?
Yeah, as far as I know, the Vidant system, I believe this morning had 55 patients across the system. So that's 55 patients across all 10 Vidant hospitals. So as far as I can tell, they would have capacity at this point.
Okay. And are you fearful about a surge in coronavirus cases after the 4th of July holiday?
I think anytime you bring people together, there's the potential for that. I saw some pictures of the beaches that were very crowded. The beach is probably a harder place to transmit coronavirus than other places, but everybody that was at the beach went somewhere after they left the beach. So there was probably some circulation and probably some transmission that's associated with that. So I would not be surprised if we do see some bump in cases after that.
Have we seen anything from Memorial Day weekend so far that you would attribute to that?
Not really. We did not see a big bump after Memorial Day.
Perfect. That's all I got for you.
Okay.
Anything else you'd like to add?
No, I think that's all I have for you this morning. I appreciate your time. Thank you for coming. Thank you for helping us promote the testing sites.